Hi everyone, Alexandra here with MDPen. Thank you for tuning in for today's YouTube live video. For today's video, our topic is getting neuromodulator treatments or fillers in conjunction with radio frequency microneedling. And don't let this title mislead you. I'm not saying that they should be done in the same day. Now, many reasons why we wouldn't want to do these treatments in the same day would be because immediately following radiofrequency microneedling, similar to regular microneedling, and even more so, because the treatment has been done, the skin can appear very tight. We also know that it has all those microchannels that are freshly open. So you can't really prep for a neuromodulator or filler treatment the way that you typically would in office with your alcohol and things like this. Also, there might already be PRP on the skin, serums, human-derived growth factor gel. So it's not really great to inject immediately following treatment. Rarely have I heard of offices that do that. And of course, you don't want to treat in office right before the RF or RF microneedling treatment. So you wouldn't want to do the injectable treatment immediately followed by the device, because as we know, you can't lay down immediately following, especially a neuromodulator treatment, or have the skin be really active or get facials or anything like that. So no, I don't recommend them being done during the same day. However, people that get RF microneedling or radiofrequency treatments can still get injectable treatments. There is a timeline for this. Also, as you guys know, not all fillers are the same. Most neuromodulators are going to be having the same effect. Some are said to kick in faster than others. Some are said to perhaps last a little bit longer, things like this. But basically, you're getting the same concept. Yes, please do ask questions, guys. Feel free to ask questions. Just type them right there in the comments. Anything related to the ND-Med, intensive, RF microneedling, or radio frequency. Now, a general rule you can go by is going to be the 2-week rule. With that being said, of course, not all fillers are the same. And this is the main question. I already see it in the comments. Does radio frequency dissolve filler? Now, it's argumentable, and doing RF over fresh, newly injected filler can. That heat is reaching the dermal layer. So yes, that's where the filler is often being done. And yes, it can break it up. So you do want to wait that 2-week mark. Also, if you want to be extra cautious, I would not do RF heating of the skin or RF microneedling over freshly injected, more superficial types of filler. So those lighter fillers that are easily manipulated and things like that. Sometimes those can be done in like the nasal labial fold area, the lower face, and things like this. Just to rattle off a few others: Sculptra, Radius, Voluma. These are deep. These are deeper fillers. They're done near the bone. So the chances of RF microneedling affecting them after that 2-week mark are pretty much non-existent. And from what I've heard and talking to most doctors and providers, there's not a huge concern there with those types of filler, because they are injected closer to the bone area. Again, the more superficial ones are the ones you want to be careful about, and allowing for that nice waiting time in there. Is RF microneedling better than traditional microneedling? So the general answer is that you're going to have faster results with less treatment. So typically that's going to be a yes. However, traditional microneedling has its place. We treat scalps, we treat hair restoration with traditional microneedling. Some people that might have certain types of metal or things like this in their face, traditional microneedling, no heat, is going to be their treatment. Some people, budget-wise, traditional microneedling is going to be the better option. So yes, both are still going to have their place. Some would say, yes, it's better because you have faster results, less downtime, and more tightening. You've got that tissue tightening plus microneedling. I see a question here. Oh, can RF microneedling be done for hair loss? No, it can't. We don't use that one on the scalp with the heat. Okay, so this is the topic of the video. Hopefully I'm answering your question. Thank you so much. I do want to give you guys a shopping code today, because one thing I do want to mention, this will save you 10% on our website with this code inject10. And please follow us across all our platforms. I do videos on LinkedIn, Facebook. Sydney's on Instagram Live Monday nights at 8 p.m. Eastern. So check all those out. But yes, feel free to go shopping online. Inject10 is your promo code. And for those of you that inject filler, I highly recommend in office applying the cellular renewal serum. If you are someone that likes to put on an HA or some product into the newly injected area, and of course you're doing this, glove just a little bit. If you've injected, let's say, the marionette lines or something, you just get right in there with your gloves and wipe that in, and you're going to clear up any dried blood, anything like that. It's going to make the filler really pop, clean things up. Again, I encourage you to try the cellular renewal serum for that. This is also one of the serums that can be applied post RF microneedling. We'll be using it in tomorrow evening's video. While we'll be needling stretch marks, we'll be applying this afterwards at the end of the treatment. So definitely check this out. This is a very healing serum. It's great for barrier repair. Again, that's why I think it's great post-injectable treatments. And also don't forget, our hydrating cleanser is an excellent prep for all in-office treatments, including neuromodulator treatments and fillers. So you can definitely use our hydrating cleanser. In my opinion, this is like our most botanical product. I love the marigold. I love the chamomile. I feel like it really pops in this product. It's got the HA and snow mushroom in it. It's gel based, so it suds up really well. You get that nice clean feeling while still having it be super hydrating and non-stripping for the skin. Let's see. Is RF better than getting neuromodulators? That's an excellent question. So a lot of people that get RF microneedling may still want neuromodulators, and I'll tell you why. So neuromodulators are preventatively basically paralyzing or partially, temporarily paralyzing the muscle from moving, which stops that line or wrinkle from being created. So RF microneedling, and really no device in general, is going to stop that. So if you need, preventative means, if you can't control yourself from frowning, from lifting your forehead, that's when you're going to want a neuromodulator. With that being said, the lines and wrinkles and textural changes that have been created as a result of these movements can be treated or fixed with the radio frequency microneedling. But if you want to be preventative and keep more from coming, it's kind of like, treating acne scars. You want to keep treating new acne that could be coming because you don't want to have more scars to treat. You want to be treating those fine lines and wrinkles from appearing so you don't have more to treat, because as we know, it's all expensive. Fillers are expensive, neuromodulators are expensive, RF microneedling treatments, could be, slightly more than one syringe of filler, but the results that you're getting, and you're having it done to your whole face. So there's a whole nother argument there. That just popped into my head. Here's a great question. How long until you see results from RF microneedling? So I have my own opinion, which matches the opinion of recent doctor videos that I've watched. I just watched one recently by Dr. Maud, who's done some webinars for MDPen, and she says the same thing I do, the same thing Cassandra Santos does. And by the time you're coming back for your second treatment, you should see things happening to the skin. Now, it won't mean that your skin has no pores, no lines, no wrinkles, but you should have brightening. You should be seeing some tightening. You should be noticing some subtle changes in the skin. I think after the first appointment, you can see major skin health changes. And again, if you want to wait 6 weeks versus 4 weeks, you can always give that collagen some extra time. But if you want to, get these series stacked and treated, just go ahead and come at that 1 month or 4 week mark. But yeah, you should start to see something happening. How long is the downtime for RF microneedling? So this is going to vary person to person. It's going to depend on the depth and the heat and the settings of the treatment. Typically immediately following treatment, the more fair your skin is, sometimes the more red you can become, similar to regular microneedling. With that heat component, you are coagulating the blood during the treatment. So this is not a bloody treatment. Very, very minimal pinpoint bleeding, if there is any bleeding whatsoever. With most treatments, sometimes you don't see any bleeding to the skin. And you'll see those tiny, tiny little grid scab marks for the next couple days on most individuals. And they're not terrible. You know, after 48 hours, you could put a tinted sunscreen, a mineral makeup, something like that on the skin, cover it up. But unless, you know, the next day, unless you have a real job where you're like right in people's faces in person, which I don't think a lot of those jobs exist that many anymore, maybe like a realtor or something. I can't really see you having, you know, to miss much time from work at all post RF microneedling, you know, depending on the treatment. I will say you can treat overactive acne with RF microneedling, but be prepared that it can still get upset or angry. Be prepared for that. And your medical director or you yourself as a physician can do things preventatively prior to the treatment so that this isn't, you know, such a big ordeal when it happens, but try to minimize the acne as much as possible. But that is one advantage of RF microneedling. They don't need to have a face completely clear of pustules and pustules and papules. Um, Let's see. Any more questions, guys? Thank you so much for all this engagement. Again, if you want to inquire about RF microneedling, please go to our website. I'm going to put this serum link up here on the screen. You can go shopping with that code INJECT10. The two products I mentioned during today's video, cellular renewal, which I love to have applied post injectable treatments, aloe, red algae, knotgrass, and I always recommend our hydrating cleanser for in-office prep of the skin. This is what we would use to remove numbing for either traditional RF or microneedling RF. Also great for prepping the skin for injectables. I hope your takeaway from this video is that 2 weeks is a safe rule. If you have someone that has the patience, like I always say, if you can just get the series of, you know, let's say they're doing 3 RF microneedling treatments stacked over a 3-month period. If your patient is up for it, have them wait to do the filler afterwards. That's the best way. You're going to be able to see those changes in the skin. They're going to be able to see it. They may need less product. They may have totally different concerns. You know, maybe they were going to, you know, treat their cheeks or their jawline. They were going to need a syringe on each side for resculpting their jawline, and now they don't need that, and now they just want, you know, something else done. So keep that in mind. If the patience is there, that's my first suggestion. But, you know, if, especially I think with neuromodulators, people that have had it for years and years, it's really hard to be without it. Your face feels weird. So for those people, and again, neuromodulators are injected, you know, at the muscle. So again, you have the RF not being as likely to touch that or break that up. So I see no problem at the 2-week mark. In between their series or before the start of their series, 2 weeks prior, they can have their neuromodulators done. So I hope this has been helpful. Here's that link for the intensive for the ND Med, which is the RF microneedling system that we have. So yeah, thanks guys. And I hope you guys can all attend our event tomorrow evening at 8 p.m. Eastern. I'm going to be at Well Rev with Stephanie Phillips. She's amazing. She's already doing a ton of RF microneedling and radio frequency treatments. We're going to be showing the shaper handpiece for tightening on the abdomen, followed by the RF microneedling for the stretch marks at the same area of the abdomen, and applying product at the end of the treatment. And we'll be, you know, taking all kinds of questions and things like this. If you're signed up with MDPen, you are getting emails where you can register for a reminder, so you can do that, or just go ahead and mark your calendar now. 8 p.m. Eastern tomorrow evening. That will be here, Facebook, and LinkedIn, all at 8 p.m. So I look forward to seeing you guys there. Have a great day. Bye.